The moments surrounding surgery can be some of the most anxiety-inducing in a patient's life. It is a time of uncertainty, often coupled with fear. In these crucial moments, a special group of healthcare professionals stands ready. They are perioperative nurses, and their role is vital in ensuring the best possible outcomes for surgical patients. But what exactly is perioperative care? Perioperative care encompasses the entire surgical journey. This includes the time before surgery, during surgery, and after surgery. Nurses are critical throughout each of these phases, providing specialized care and support every step of the way. Their expertise and compassion help to ease patient anxieties and contribute significantly to positive surgical outcomes. Think of perioperative nurses as the guardians of the operating room, always vigilant, always prepared. They are advocates for their patients, ensuring their safety and well-being from the moment they enter the preoperative area until they are discharged home. In the following sections, we will delve deeper into the specific roles and responsibilities of these dedicated healthcare professionals during each distinct phase of perioperative care. The preoperative phase is a critical time for nurses to establish a relationship with their patients and lay the groundwork for a successful surgical experience. This begins with a comprehensive patient assessment. Nurses obtain a detailed medical history, including any allergies, current medications, and previous surgeries. Patient education is another cornerstone of preoperative nursing. Nurses provide clear and concise information about the upcoming procedure, including potential risks and benefits. They explain what to expect before, during, and after surgery, empowering patients to be active participants in their care. For example, a nurse might walk a patient through the steps of deep breathing exercises they will need to do after surgery to prevent pneumonia. The final stage of the preoperative phase focuses on preparing the patient physically for surgery. This can involve tasks such as starting an intravenous line, administering medications as prescribed, and ensuring the surgical site is prepped according to sterile procedures. By the time the patient is wheeled into the operating room, they have already benefited significantly from the expertise and compassion of the perioperative nursing team. As the patient enters the operating room, the role of the perioperative nurse transitions to one of acute vigilance and skilled assistance. During surgery, nurses are responsible for a wide range of tasks, all of which are essential to ensuring patient safety and a smooth surgical procedure. One of the primary responsibilities of the intraoperative nurse is to assist the surgical team. This could involve passing instruments to the surgeon, preparing the surgical field, and ensuring the operating room remains completely sterile. Throughout the surgery, the nurse continuously monitors the patient's vital signs, such as heart rate, blood pressure, and oxygen levels, alerting the anesthesiologist or surgeon immediately if there are any concerning changes. Imagine, for example, a patient's blood pressure starts to drop during surgery. The perioperative nurse, diligently monitoring the vital signs, would recognize this as potentially serious. They would alert the anesthesiologist, who would then take appropriate steps to stabilize the patient's blood pressure. Section 4. The road to recovery. The postoperative phase. The postoperative phase begins immediately after surgery and continues until the patient is discharged home and cleared to resume normal activities. During this crucial time, nurses play a vital role in monitoring the patient's recovery, managing pain, and preventing complications. As the patient emerges from anesthesia, the nurse is there to assess their level of consciousness, vital signs, and pain level. Pain management is a top priority in the postoperative period. Nurses administer pain medication as prescribed and monitor the patient's response, making adjustments to the pain management plan as needed. In addition to pain management, nurses are also responsible for monitoring the surgical site for any signs of infection, such as redness, swelling, or drainage. They also provide education and support to patients and their families on wound care, medication management, and any activity restrictions they may have. For instance, a nurse might teach a patient how to care for their surgical incision at home, ensuring they understand how to keep it clean and dry to prevent infection. Throughout the postoperative phase, nurses act as advocates for their patients, coordinating care with other members of the healthcare team, and ensuring a smooth transition back to their daily lives. Section 5. The indispensable role of nurses in perioperative care. The journey through surgery can be a daunting one for patients and their families. But throughout this journey, from the initial consultation to the final stages of recovery, perioperative nurses are a constant source of knowledge, expertise, and compassionate care. Their role extends far beyond simply following doctors' orders or administering medications. Perioperative nurses are educators, advocates, and skilled clinicians who are essential to ensuring the best possible outcomes for surgical patients. Their dedication and commitment to patient safety and well-being are truly remarkable. They are the unsung heroes of the operating room, the guardians who guide patients through one of the most vulnerable experiences of their lives. As our understanding of medicine and surgery continues to advance, the role of perioperative nurses will only become more critical. Their unique skill set and unwavering dedication will continue to shape the future of surgical care, ensuring that patients receive the highest quality care and achieve the best possible outcomes.